Hi, welcome to Sidewalk Talk. I'm Steve Fortunato, a founder of Shovel the Sidewalk marketing firm in Buffalo, New York. We help small businesses build their brands and create their advertising, and we utilize authentic storytelling to do so. We're practicing our social distancing. I have TMJ specialist Dr. Frank O'Day on the show with me today, and what we're going to do and what Doc has agreed to do is try to help. We're looking. Sidewalk Talk is pivoting, right? We all are in this world right now that we're living in. So we're looking for ways that we can all help each other. And Dr. O'Day has been kind enough to come on with us and see if he can help people who are in pain. But right now, Doc, tell us about your practice. You like the rest of the world, you're shutting it down for a little while, huh?
Yep, we saw limited patients this week, and as the guidelines came down, we ended up having to close up shop, effective about 2 o'clock today.
Yeah, well, you're doing your part. At the time of this recording, I know the governor of New York just came on. All non-essential positions, everyone's supposed to. We're
Yeah,
pretty much shutting down the state except for essential jobs. Um, but for you, you help people, right? I mean, you are, what are we, board certified by
yeah.
the American Board of Oral Pain.
Hmm.
By the way, Doc is in Tonawanda, New York. So right now, I I mean, none of us have ever lived through a pandemic or worldwide, or at least a worldwide pandemic, right?
Right.
So you deal with people that are a lot stress is I'm assuming a big cause of TMJ.
It really is.
Right?
Yeah.
So what
Yeah.
can we do here? I mean, people are stressed out. So I'm
Right.
assuming there's a lot.
Sure are.
So what
Yeah.
can we do? Well, how can you help? What can you advise people to do?
Well, here's the thing: is that our normal daily lives are stressful enough, and we often will internalize our stress into our facial muscles and things like that. And that can really lead to a lot of activity that is unwanted within your facial muscles. And the best thing that you can do through this overly stressful time period is to try to pay attention to what's going on with your facial muscles and try to be as relaxed as possible uh, in the facial area. What that is doing is um, I almost think of a TMJ issue in most cases as a repetitive use injury, much like golfer elbow or a carpal tunnel, where you're just kind of doing the same thing over and over again with a group of muscles, and it makes it sore. And what you need to treat those types of injuries, generally speaking, is rest. It's more or less the same thing with the TMJ problem that 95% of the cases, it seems to me, are caused because of what I would call people know as clenching, or I do tend to refer to as facial muscle hyperactivity. Um, and that's a normal human response to daily stresses and activities. It can happen even if you're not stressed. You're just habitually doing it. But it certainly does tend to increase in stressful situations. And I can't think of a more stressful situation that I can remember, uh, maybe since 9/11. So as far as that goes, the main thing that you want to do on a regular basis is try to decrease that facial muscle hyperactivity. It's something that you can do while you're at home. If you just try to put your mind to it and think about relaxing your facial muscles as much as possible, just know that whatever muscle activity you have going on with your face or clenching is not helping your problem. It's making it worse because it leads to painful situations within your face and the jaw area.
There's probably, I mean, patients that have been fortunate enough to see a specialist like yourself are probably aware. Oh boy, that's my TMJ. Um, but there's probably a lot of people. I'm assuming I'm not. You can back me up if I'm right. Correct me if I'm wrong. There's probably a lot of people that have gone on undiagnosed. They've always had this different
Sure.
pain, and it
That's
may
very
be
common.
triggering even worse. It,
Yeah.
it, it's got to be worse right now, right? For a lot of people.
Yeah, a lot of symptoms that you may not even know were TMJ related would include something like if you're having ear pain, what we refer to as earful, is kind of a clogged feeling in there. It can even lead to tinnitus in some cases. Um, on top of that,
That's ringing
there's,
in the ear.
yes, ringing in the ears, yes. On top of that, there's things like different types of headaches. Often, what is referred to as a sinus headache can be TMJ related. Um, and there's the old standbys, the clicking in the jaw, locking with the jaw, and other types of facial pain are generally speaking part of what we call TMJ or TMD.
So, yeah, what exactly what is TMJ or TMD?
So TMJ is the name of the two joints in your face. So basically, they're right in front of your ears, right here. They connect the jawbone to the rest of your skull. So that's the name of the joint. And TMD is just the temporomandibular dysfunction or disorder is just an issue with the structures of the joint. Now, structures of the joint include both, the bones, the cartilage, the muscles, the tendons. So it's not just right here, but it's really throughout the whole side of your head, and that's both sides of your head. So it's almost your whole head.
All right. So for those people that have TMJ and don't even know it, you mentioned for your patients, they probably connect with what you're saying. Oh, doc has already taught me how to relax the muscles in my face. For those that have never been diagnosed or never sought help, is there any advice you can give them? And how do you relax your face?
So it is most certainly easier said than done. Okay. The first thing we tend to tell people is that your teeth should not be touching each other. Okay. In order for your facial muscles to be relaxed, your teeth need to be apart. Um, I often ask patients, and they say, "Do you think you've been clenching?" I'm like, no, I don't think so. And then I tell them, later on down the line, tell them your teeth should not be touching. Like, well, my teeth touch all the time. Uh, so it's something you may not even be aware of at this point, but yes, the first thing you want to know is that your teeth should not be touching each other, really, unless you're chewing or something like that. Um,
So you're not even talking about when you're sleeping. You're talking about just
during,
sitting here.
during the daytime.
Your
Yes.
teeth should not be touching.
Right. Yes.
So focus on that, and that might help.
Yes. Keep the teeth apart. Now, the other thing that we do tend to tell patients, and this isn't the best time for that, but take a deep breath and just kind of relax and let it out. Okay. Now, as long as you're practicing social distancing at this point, you can still do that. Just be mindful of the people around you as you're trying to train yourself to do this. You don't want to be breathing all over people at this point in time. But that's a good way to, sort of uh, figure out how to get those muscles into a relaxed stage. It's a nice big deep breath. Think of letting the jawbone just kind of drop and hang nice and loose, just with really the only force on it being gravity. No force from those muscles. Getting those muscles into a relaxed state with the teeth apart.
Is there anything people can do nighttime? I know medically aside, without your house, is there something is there a home remedy for nighttime that might help them so they're not in pain in the morning?
Best thing that you can do is monitor your daytime clenching. Nighttime clenching, um, really the only things that are out there are night guards, and those are helpful. Okay. But at this point in time, um, you can't really get night guards. You don't want to. Drugstore night guards aren't very helpful. People just tend to chew on them more, and they can actually increase facial muscle hyperactivity in your sleep. Sure, they do protect your teeth from the forces that you may be generating while you're sleeping, but as far as helping a TMJ problem, not very helpful. If you even look on the package in the small print, they will say these are not to be used for TMJ problems.
Huh.
So ideally, you do want a specifically designed TMJ night guard to help reduce the pressure on the joints through the muscles while you're sleeping, because it is also happening in your sleep, as well as the daytime we've been talking about. So, but right now, with I know my practice is closed for the foreseeable future. Things that you can do that will help you long term, during this time frame, is to work on that daytime muscle activity.
So do not clench your teeth obviously, but don't have you, the way to focus is just don't touch your teeth
Yeah,
together
that's
during the day.
the easiest thing to get across.
That's
And,
great.
and with the nighttime, don't worry about it. You're going to go to sleep. You can't really control what you're doing in your sleep, so don't try to. Just go to sleep and get the best sleep that you can. That would be my advice for you. In lieu of having a night guard that you would be using.
And when things get back to normal, then you can get would you call it, a fitted night guard? What do you call it?
A TMJ appliance.
Okay. All right.
Yeah.
Well, how you doing, Doc? I mean, this is tough. You're a small
Mhm,
business owner. This is your livelihood.
mhm.
You're doing your service by um, shutting it down. You're
Yeah.
doing what you got to do. How you feeling? How you guys doing?
So far, so good. I feel fine. I've not had any symptoms yet. That doesn't mean that you can't be positive. So we've been practicing, following every guideline from both the state and the federal government thus far. And that led us to, now closure. Okay. But for now, we're doing fine. How things work out going in the future, it just depends on how long this lasts, like with everybody else. Who really knows?
You know, are you as relaxed and calm inside as you are making it appear that you are? Is that you? Because
I
you're
try
very relaxed. Yeah.
Yeah, I try to be on a regular basis. Some days is harder than others. These are very challenging times, like we've been saying, and some days are harder than others as far as that goes. But I just try to keep in my mind that things will move along. We'll get through this over the long haul. We just got to do our best and do our part to make it as easy as possible for everybody involved, or the whole community.
No doubt, and I appreciate your calmness and your voice of reason. No doubt in my mind. I mean, we have no choice. We're going to have to get through this. What's the other choice? Go run for the
Right.
hills?
Exactly. Yeah.
So, but it is great. I'm so happy to have you in our community. Great person, great family. You and your wife Rachel. We appreciate you guys very, very much, and I thank you for doing this and taking the time out and offering people advice. So, my number one takeaway is, the best way you can help yourself through these tense times, if you're getting these TMJ symptoms, is during the day, just concentrate on the fact, just don't let your teeth touch, and that could help you get through this, right?
And relax those facial muscles, and limit your chewing too. No gum, don't bite the nails, things like that too. Try to
Okay.
decrease, the little softer diet, and you can always put some like a nice moist heating pad in the face too. Lie down with it. That's a good thing to do as well.
All right. Dr. Frank O'Day, TMJ specialist, thanks for your help. Thanks for
Thank you.
thank you. It's great advice for everybody out there. You can, if you want to check any of our podcasts, you can go to the Shovel Sidewalk website, shovelthesidewalk.com, and check out any of our previous podcasts. You can also download our podcasts on your platform of choice. And if you have anybody, or if you or somebody like Dr. O'Day has something that they can offer to people that will help us during this difficult time, fill out the form that's on our website, and we'll get you on this podcast, and we'll get your message and your story out there, because we're all in this together, and we're going to get through this together. So thanks again, Dr.
Absolutely.
O'Day. Thanks again, everyone, for listening and watching and for participating. I'm Steve Fortunato, and this has been Sidewalk Talk.